papillary renal cell cancer is the second most common of the renal cell cancers. The way we know that some of these cancers are actually inherited, they have certain genetic features which we count under the kind of inherited form, and some of them, especially in papillary renal cell cancer, being sporadic alterations. What's interesting here that it seems to be in papillary renal cell cancer, c-Met is the only really pathway which is altered and is driving the cancer. More and more evidence comes that there is actually worse survival for the papillary renal cell carcinoma, specifically in the view that there are actually no active treatments available. So it's a really in-need population, and you know, being biologically defined makes sense to treat them in a trial. Volitinib is a drug which is currently tested in a phase 1 study, and we have very good data. Safety data on this study, so it has been recommended phase 2 dose established, which we're using for papillary renal cell study. Volitinib is a drug, it's a very selective c-Met inhibitor. Volitinib is a tablet form, so you take a tablet a day, and so compared to chemotherapy, very easy to administer. Patients take it at home with food. That's the way the drug is administered. The design is a phase 2 study, open label phase 2 study, where response rates are the primary endpoint. But you know, one need also consider, and that's what we call secondary endpoints, the time being on study. If you have a response, how long you response, what is your progression-free survival. It's important to mention that we are recruiting frontline and pre-treated patients as well. Because we believe that the biology is actually driving the cancer by giving them and expose them to this drug, to the c-Met inhibitor, we believe that the biology is stopped, and this is then regardless of first line or second line or even third line treatment. Generally, if patients have good organ performance status, kidney function, renal function, and generally good performance status, these patients are eligible. We actually include in this trial, and this is probably important to mention as well, first line and second line or even third line patients. So patients who received other treatments before, obviously no c-Met inhibitor or drugs which are targeting this pathway, these patients are excluded. It's an open-labeled phase 2 study. The way we have, again, to make sure that we get the signal very early on, build this in a statistical design, a phase step 2 design, where the first 20 patients are looked after. If you have a certain threshold of response, we go further for 75 patients in total. Overall, this trial recruits in 40 centers around the world. So again, because it's a very rare tumor type, for 75 patients, we recruit from 45 centers around the world.